I really feel that it's important not to demonise people for having genuine concerns.
In this makeshift studio, Pastor Emmanuel Adeseko is hearing vaccine worries from his congregation every week. He lost his dad from COVID-19 last year and is making it his mission to share information about the vaccine with the people who trust him the most.
There is real, evidence, from history where there's been concerns about, experimentation. There is a history and there are plausible information that supports that. There's also been negative experiences that people have had in terms of healthcare. I think it would be irresponsible to just demonise the black community for having these queries.
Hesitancy isn't rooted in that you're just simply being difficult.
For Dr. Vanessa Appiah, who's a vaccinator, she's on the front line of taking on the task of rebuilding trust within diverse communities.
There's a mistrust of the societal structures that we have, and really thinking, am I seen, am I recognised, am I valued, and will I be advocated for? We are just there to say things have changed, but we really appreciate and recognise what has happened before.
One of the key examples of historical medical wrongdoing against black people is the Tuskegee trials. Although in the United States, the lasting legacy of the mistreatment of the men involved is an issue that cuts deep for some in the black community. It was a 40-year experiment looking at syphilis in Alabama, following 600 black men. Researchers refused to tell patients their diagnosis and actively denied treatment, leading some of the men to die or pass the illness on to their wives. Whistleblowers eventually brought a stop to the unethical study in 1972.
What the United States government did was shameful, and I am sorry.
Free our sisters! Free ourselves!
And here in the UK, in the late 70s and 80s, women protested against the testing of a contraceptive drug called Depo-Provera on black and Asian communities. Nowadays, the drug is licensed and a commonly used contraceptive. But in the past, during the testing phase, activists accused the drug companies and some in the medical profession of using it on women without their knowledge or consent. One prominent obstetrician at the time observed that the majority of those offered the contraceptive were from marginalised communities, including one example of a young black girl given the drug while under anaesthesia. In the present day, health inequality persists. Throughout the pandemic, black people, Pakistani and Bangladeshi men are almost twice as likely to die from COVID-19 than white people.
Now, the stakes and the risks are too high.
Dr. Habib Naqvi, among others, has been calling for data on ethnicity to be published for weeks to get a better picture of vaccine hesitancy. That only happened today, NHS England confirming they will do so.
What we know within the health sector is that what doesn't get measured doesn't get done. We need more insight into the data around who's taking up the vaccination.
It's taken 7 weeks for the authorities to acknowledge the need for this information, and it's crucial for them to know exactly how many ethnic minority people are turning down vaccines and why, so they can start to tackle this problem.